And welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning. I'm Dr. Todd Shatkin, and welcome to this Monday Morning Minute. Today we're going to just be cementing a 3-unit bridge on top of 2 monos and 1 mini implant. People ask me all the time, can you combine monos and minis in the same restoration? This is a prime example of us doing just that. As you know, the mini implants are great for a lot of different uses, but sometimes we like to use something a little beefier like a mono implant, which has a little more aggressive threads, and it also has a preppable abutment and bendable abutment if you want a bendable mini mono or mini implant. So let's show you our case here. We have Cindy here, who's one of my favorite patients. We've got the 3 implants here, 2 monos, 1 mini. I always like to tap on them. Makes me feel good to hear that nice solid sound. And she's got implants over here as well. And so now we're just finishing this here. She has very, very little bone in the back, so unfortunately we were stuck with just doing the anteriors for now, but and we've done other implants on her on the bottom. She needs some work over here as well. But this is the bridge, and it's the first time I'm trying it in. It looks beautiful. Bite together gently, okay? Bite in the way back teeth. Open, relax your jaw, and close. There we go, okay. Bite looks good. Open for me. And you want to make sure it's down all the way on the lingual side, which it is. Make sure the inside is all the way down. The other mirror, this one's it. So hold it in place and okay, very good. Okay, we'll have her take a look at it. I always want my patients to look at them. Bite together before we go ahead and cement it. Let's see what you think.
Perfect.
Looks nice. Whoop, it's loose.
Yeah.
Bite together. Okay, do you like it? Mm-hmm. Color's pretty close to the others, right?
Yeah.
Okay. All right, so we'll just have her sit up and sign off on the color and the shape, and then we'll go ahead and cement that. Do you have that all set for her to do?
Yeah.
So we're going to use the Shatkin F.I.R.S.T resin cement, which has been on the market now for close to over 20 years. It's a great product. And I really like it because it's self-curing. I know you're all using lots of light-cured cements, but you know, I use my light, and we've got the overhead light, and the resin cements cure very quickly with surrounding light and with the loops, the light on the loop. So I really like a self-curing resin cement because it gives us a little bit more time to work with it and doesn't harden as quickly. And for the cases I do, I really prefer that. So, and this is a great product. We're going to go ahead and just dispense a little bit here. You want to always make sure it's mixing, so we dispense a little bit first. Try it, please. Mm-hmm. And we're going to go ahead and put a little cement in all 3 holes. You can see the cement in the holes. And I also like to put a little bit of cement on the implants themselves to avoid any bubbles, air bubbles. So we just put a little bit of cement. Okay, and we'll go ahead and seat the restoration. Just like that. And what we're going to do is just going to hold this here for a minute. Let me see, I got it. Okay, now you can bite together. Hold your finger right here, okay? Hold it.
Stay biting. Go ahead, bite down.
Just like that, okay?
Yeah.
All right, so in about 2 minutes here, it'll set up, and then we'll clean up the cement.
Let me give you all of them.
Here, open. Here, just suction for me, please.
Yeah.
All right, we're just cleaning the cement off. Suction, please. Mm-hmm. Okay. Bite together. Does the bite feel good?
Mm-hmm.
Let me just check the bite. Bite together. Open. Bite again. Open. It's hitting a little bit heavy on this lateral incisor. Bite together. Open and bite. Tiny bit more. Just hitting a little bit right here. Okay, bite again. Oops, sorry. Open, bite. Bite again. That's better. One little small. Okay, and bite. And grind your teeth side to side. Open and bite. Grind side to side. It's important to get the lateral excursions and all of the different things. Bite together and now slide forward. Okay, hitting a little there. Okay, open. And do that one more time. Slide forward. Let's see, open and slide forward. Bite and grind, back, back. And then slide forward, okay. Open, yep. Yeah, you don't want it to be hitting too much and different movements. Bite again and slide forward. You want to be in open, group function here. Bite together and slide forward. Open. And do that again. Slide forward. Yes, so it's hitting a little heavy on this central. Slide forward a little bit. And open and do that one more time. Okay, open. Let's see. And again. Okay, bite in the back. Back teeth. Do a little more. I gotta smooth those lower incisors a little bit. What I want is for both centrals to be touching at the same time and protrusive. So I'm just evening these teeth up so that they're touching together. Do that again, bite again, and slide forward. Open, hitting a little bit on this lateral. And again, slide forward. That's getting better. Open, and do that one more time. Open, one more time. Open. And again. Open. And close again. Slide forward. Open again and do it one more time. Bite and slide forward and side to side. Open. Okay, I think we're much better now. And one more time. And you want to feel it with your hand. You can feel the crepitus. You can feel bite together. If there's any excursive, you can feel it. Do it again. And that looks pretty good. Okay, I think we're in good shape. That feel good?
Yep.
All right, give a nice smile for the camera. Looks gorgeous. Let me see. I'll take a little floss here. Little piece of cement there, I think we just got out. Okay, very good. Thank you, Cindy.
Oh, thank you.
Have a wonderful day. And
You
say hi to
too.
John for me.
I will.
And thank you for joining me on the Monday Morning Minute. We'll see you next time.
Join us this fall in Buffalo on Friday, September 19th and Saturday, September 20th for an intro course on mini dental implants. Come learn how this amazing procedure is helping so many people throughout America. And learn from Dr. Todd Shatkin, who's placed over 45,000 mini dental implants in his career. So come and learn from the best. Out here in Buffalo, New York, we'll see you soon.